Hi, this is Vaibhav Vaidya with Fits on the Go blog here at AHA 2015 in Orlando, Florida. We have the privilege to be joined by Dr. Paul Whelton, who is the chairman of the SPRINT trial and also the chairman of the ACC AHA Committee for Blood Pressure Guidelines, which will be coming out in 2016. It's a real pleasure to have you here, sir.
It's my pleasure. Thanks for inviting me to join you.
Great. For our viewers, could you just summarize the results of the SPRINT trial that everybody's been talking about?
Well, as you know, in SPRINT, we were looking to see if going to a systolic lower than is currently recommended would be beneficial or not. And we randomized about over 9,000 individuals, all over the age of 50, all had high blood pressure, and all had an additional risk for cardiovascular disease. Got good blood pressure separation. And then after about 3 years, the trial was stopped early due to benefit. And the benefit was for the primary outcome, cardiovascular events, there was about a 25% reduction overall, big reduction in acute decompensated heart failure and cardiovascular death. And there was also a really important 27% reduction in all-cause mortality. So those were the two really driving factors for the Institute to make the decision to stop the trial. On the flip side, there were some indicators of concern, and we don't really know how to interpret them yet, but we saw some renal disease signals, not in the patients with renal disease. They did just fine. In the people who didn't have renal disease, we took a very sensitive marker, and we saw some change in GFR. It may just be drug effect. We saw some admissions and discharges that mentioned acute kidney injury, acute renal failure. We don't know what it means. We got to follow that. We saw less hypotension in the intensive group, surprisingly to me, I think to most people. But we did see a little more in the way of hospitalization for hypotension and syncope in the intensive group. It didn't amount to an increase in falls and fractures. So overall, the benefits seem to be very dramatic. There are some indicators of adverse events that we need to monitor and follow carefully, but probably not a huge issue as far as we can tell.
Thank you so much, Dr. Whelton. In terms of other analyses from this study and other outcomes such as dementia, in-depth analysis of the renal failure, when can we expect to see some of those results?
Well, we got stopped in midstream, and we had anticipated doing our final evaluations for cognitive impairment, dementia, MRIs, and renal function as well at a later stage. So we're now in the process of doing those final visits, and they'll be completed by 2016. We also agree that those are very important outcomes. We hope that there'll be a possibility for extended follow-up of this cohort, which I think will be helpful, and that's something we're discussing with the institutes at the moment.
That's great. We'll all eagerly look forward to those results. One final question, Dr. Whelton. What advice would you have for fellows who are planning to embark on a career in academic medicine?
Well, I think it's a fantastic career. Probably most of you, like me, didn't know where you'd end up. And medicine is a wonderful way of taking you into really strange and exciting places. So it is a frightening career, especially now, more frightening than when I started, but nonetheless really exciting. And I think, if you focus hard, do what's in your heart, do what you're happy with, don't worry about what anybody else thinks you're doing the right thing, the wrong thing. Just do what you want to do. You'll always make a living. You can always go to bed at night feeling good about yourself, haven't got to sell your soul, and you'll do some good. And maybe you'll be as lucky as me to have the excitement that I've had in my career. And if you have a good partner, that's really important, I think, for an academic career, because you do need long hours, you do need to be away from home a lot. But I think for me, it's been a great career. And both of my children, as I mentioned, are in cardiology. They're both smarter than me, and I'm excited to see the career that they're progressing on.
Thank you so much for your advice. So follow your passion is what Dr. Paul Whelton is telling us. So for more videos like this, please log on to www.youtube.com/fitsonthego. Thank you.